Hi, I'm Dr. Jess Anderson, a veterinarian at Cottonwood Animal Hospital, and today I'd like to show you how to do subcutaneous fluid therapy in your pet at home. So what you'll need for that is a fluid bag, an IV type bag, an IV drip set, and a needle. So I'll go through the steps of how to hook up the IV drip set to the fluid bag. Most of them come in these sealed containers. You just tear them open and take the bag out. The same thing for the IV drip set. On most IV fluid bags there are two ports, one of which is to put an additive into the subcutaneous fluids or into the fluid bag, which you probably won't be doing. The other one is to put the tip of the IV drip set in. So if you pull this little guard off, that's just to keep this clean and sterile. And you get your drip set ready. You'll find on the one end of your drip set you've got a little guard there to keep this clean and sterile. So once you remove this, you don't want to touch that. It's got a sharp point, and you direct that point right up into that opening into the bag. It punctures the bag, and at that point your IV drip set is hooked up. So now the IV drip set is connected to your IV fluid bag. It's full of air, and we want to remove the air from this line and fill it with fluids. And what I would do first is turn off the IV drip set. So there are two ways to turn it off. One is just a simple clamp. You can see how it works. It just pinches that line and doesn't allow fluid or air to pass through that line. The other way is this little adjustable clamp, and it rolls down. This is to adjust the rate of fluids when we are giving IV fluids and not subcutaneous fluids, so you probably won't use this other than to turn this off. But if you roll it all the way down, it will pinch that line and turn it off as well. So I am just going to close the line off with this clamp, and I'm going to hang my IV fluid bag up somewhere high. We have an IV fluid stand here. You can also use a coat hanger, a metal coat hanger, where you use the hook to hang the bag, and you have the other part hanging on, part of your blinds or something else like that. Now that it's elevated, the fluid wants to run down through this line, but we've got it closed off. I'm going to prime the line by opening the clamp, and fluid will run down through the line and flush the air out. And when you see fluid come out the tip of this line, you just close it off again. So there we go, all the air is removed. The next step is to put a needle on this. And when you do subcutaneous fluid therapy at home, it's best to use a new needle every time you perform the fluid therapy. So here's a brand new needle, and attach the needle to the line by pressing the line into the hub of the needle. And now the needle is attached to the line and ready to go. This is my dog Ivy. She's a little nervous to be on camera. You can tell she's shaking a little bit. She actually just doesn't like being up on this metal table. But she'll be a pretty good patient for us today. So the next step is to put the needle under her skin. And this is the most intimidating part for most people, because you're poking the needle through the skin of your pet. Fortunately, dogs and cats have skin that's much less sensitive than ours, and they generally don't resent this too much. So what you want to do is remove, and this is a brand new needle, and make sure that your IV line is in an off position, but remove the cap from that needle. Tint up a small amount of skin, and place your needle through the skin. You don't want to go straight down, and you don't want to go straight over, but at a slight angle down through the skin. And you can see Ivy didn't even twitch or flinch or look back. It was completely unnoticed by her. It's not very painful to dogs typically. Now that we've got the needle in place, if you open the line by unclamping the line, the fluid will start to flow. And you can check the fluid flow by looking at your IV bag. So a couple more tips on running IV fluids. One is, the higher you raise the bag, the faster the fluids are going to flow. And for most patients, it's okay to run the fluids very, very quickly. You're not running these fluids into the vein, you're running them under the skin, and they're going to accumulate under the skin. You can see here on Ivy, there's a little lump forming as those fluids are accumulating under her skin. They'll be gradually absorbed later, so you won't harm them by running the fluids quickly. Some pets find it uncomfortable to have the fluids run very quickly, and you can run them more slowly. But if you'd like to get the process accomplished faster, you can run them more quickly by raising your IV fluid bag. That will increase the rate of speed that the fluids are flowing through the line, and you'll administer more fluids more rapidly. So if you notice that your fluids are not flowing very quickly and you've got your bag hung at a good height, One thing you can try is just to gently reposition the needle. As this fluid builds up under the skin, pressure will build up as well, and it will resist flow. And if you just move the needle slightly, often you'll see that the flow is increased, that the drip indicator will show you that you're administering at a higher rate of speed, which is helpful, so you don't have to sit there and hold your pet for a long time while you're giving fluids. So another tip is that you may find that your indicator here becomes completely full of fluid and you can't tell if any fluid is running. What you can do is invert the bag, squeeze that little chamber, it will squirt fluid back up into the bag, and then draw that little bit of air on top of the bag back down into the indicator. And then you can see there's a space there where there's air, and you can tell whether you're running fluid or not. In this case, the line's shut off and there's no fluid running, there's no drip there. So when we give subcutaneous fluids at home, we don't give a really precise amount. Each line on this bag indicates 100 mLs or 100 milliliters of fluid. And we usually give subcutaneous fluids in intervals of 100 mils. For example, cats may receive 100 or 200 milliliters of subcutaneous fluids per day. Larger pets like dogs sometimes will receive 500 or even 1,000 milliliters of fluids per day. So each line on here as the fluid goes down indicates that 100 milliliters has been given. It's not really precise, but it's close enough for subcutaneous fluid therapy. When you finish administering the subcutaneous fluids, all you need to do is draw the needle out. Now there'll be a small hole there where the needle penetrated the skin, and oftentimes a small amount of fluid and sometimes even a little bit of blood-tinged fluid leaks out, and that's okay. But it does help as you draw the needle out to pinch that skin and roll it in between your fingers. That'll help close that little hole where the needle punctured the skin, and you won't lose as much fluid back out of that space.